My name is Melissa. I'm a perinatal mental health counselor, and I've had 2 miscarriages. After a loss, there's so many emotions that people can feel. I always say there's layers of loss.
The typical emotional impact of pregnancy loss is definitely grief. It's that feeling of longing for something that's no longer present. It's a feeling of sadness, sometimes feelings of guilt and shame. Some common symptoms and reactions. We're going to go straight with the Kubler-Ross stages of grief, right? So we're going to have sadness, we're going to have anger, there'll be depression, there'll be bargaining of like, why is this happening? Or I would give this for that. And then we get to a space of acceptance. The grieving process is a non-linear journey. It's okay to go from anger to acceptance and back to sadness because it truly is a process that you're learning to acclimate yourself with. It really is coming to terms with your new normal and being okay with that non-linear journey through grief.
There's a lot of barriers, but some of the main things I thought about were the shame and the silence that kind of comes with not having family to reach out or other people to talk about that loss with. There's some kind of messaging around when we talk about preventing miscarriage to women, we talk about the things that they can do to improve their lifestyle, improving their health. And so sometimes the first time that they had the loss, their first experience is, what have I done? Did I do something I shouldn't have? Was I not taking in the optimal amount of nutrients? And so that can be really hard. That self-blame can come in, and so it makes it hard for them to reach out.
There's a lot of misunderstanding about what miscarriage truly is. Oftentimes I see when people navigate through hard things, they want to find a place for the blame. And a lot of times women will take on that shame, that guilt, that blame because they were the ones carrying the baby.
I really recommend that they reach out to a professional and get support right away. In the initial stages, there's a little bit of that shock, and they might be coping just fine. But at the same time, we know that there's a period of time after a crisis where we go into crisis mode, and we might feel energized. We might be thinking positively, thinking that we're ready to try again, ready to move on. So sometimes it might be hard to recognize some of the things that they're coping with. In the first year after a loss, there's some research that shows that miscarriage can quadruple a risk of suicide. And with therapy, some of that evidence is that someone can reduce their risk by about 25% if they're in some kind of talk therapy.
A lot of times people don't get referred to mental health support because they don't know who to refer to. So I think there's really an opportunity for therapists, especially therapists and clinicians who have perinatal mental health certifications and courses of study, to really show up and really get out in the community and advocate that there is a niche of mental health support for families who are navigating this side of grief, this side of loss, this side of postpartum, to really help rehabilitate them within their new normal.
I wish I hadn't waited so long to do therapy. That's where we can sit with someone and just let them be. All the feelings are welcome as they get to their own path to healing. I love the idea of having a clinic with those services readily available.
So Haven is creating a space that allows women who are navigating through early pregnancy loss a space to feel what they truly feel. Loss at any stage is difficult, but early loss is a very special space that needs to be managed with a different type of care. And I think Haven is going to open up the opportunity for families to receive that type of intentional care and love, so that they can have the space to heal and move forward through their loss and into their new normal.